Welcome to your Mamamoon podcast with interviews and tips from real life for your pregnancy journey from belly to baby.
We are Tessa and Nina, and we are passionate about motherhood. Our goal is to give you tools towards a beautiful and empowering experience during labor and a smooth entry into life as a mom. Hello. So welcome everyone today to this Mamamoon podcast. And today we are very lucky because we have with us Corinne, who is, among other things, also an amazing acupuncturist focusing on women's health. So we are very, very happy that you can be with us, Corinne, today, that you can tell us a little bit more about the magic of acupuncture when it comes to women's health, especially during that period of pregnancy. Which is such a special period for each of us. Before we start, could you maybe tell us a little bit about yourself, if you can give us a little bit of your background?
Okay, well, thank you so much for having me. So my background is I started working as a nurse like many years ago. So I have a nursing background. And then I went on to specialize with working with mothers and babies. That was back in the UK. When I came to the Netherlands, I had a bit of a career change. So I decided to study Chinese medicine. And I qualified as an acupuncturist, but also as a trainer therapist. So I've been working now in Amsterdam for the last 5 years.
Beautiful. Thanks so much, Corinne. It's really great to have you with us. When we do Mamamoon podcasts, we always try to cover the entire journey from belly to baby, as we always say. So we're really looking to help parents to be during their pregnancy, birth, postpartum, and then also parenthood. And your knowledge and your expertise seems to cover all of that. So I think that's especially cool that you're with us today. But we probably need to narrow it down a little bit so that we hear that otherwise we'll be talking for hours. So let's focus a little bit on pregnancy and labor as the first stages of that beautiful journey to baby. And then we'll probably have a separate session on postpartum, as is my feeling right now. Can you tell us a little bit about the aspects in your work that help pregnant women with acupuncture or during pregnancy, basically?
Okay, so acupuncture, I mean, the history of acupuncture and its use during pregnancy has a very long history. And probably here in the West, it's gaining popularity. So probably the last 10 years or so, it's become more and more used. So you see a lot of women looking for an acupuncturist during their pregnancy. In my practice, I see women at every stage of their pregnancy. So very much from very early on in the first trimester, right through to when the baby is due, their birthing months. Women come to me for all kinds of pregnancy ailments. So think of things like insomnia, nausea, fatigue, aches and pains. I mean, the list is quite long. So, but that's what I see in the practice, that you have a lot of cases from women from every stage.
And that sounds pretty amazing. Also, like all those, let's say, elements that you can actually help with. But how does it actually work? Because that's a little bit, we hear that the acupuncture is good for us when we're pregnant, but what stands behind that magic of acupuncture? What it is that you're actually doing?
Okay. So with acupuncture is that we don't just treat the symptoms. So we try and get to the root of the problem. So very often when we get to the root of the problem, it helps to resolve those issues. So it's not just putting a little plaster on and say, okay, you're now feeling better, but it's really getting to the root, because the minute that you have a pregnancy ailment, let's take, for example, insomnia, it means that there's an imbalance in the body. So then the trick, if you like, or the magic of acupuncture is actually getting to that root cause and treating it, because then the effect is much greater. Obviously, with acupuncture, we do use needles. That can be something that some people are put off with, because they say, oh yeah, needles. And but with the women who come to me, have never had acupuncture before, they are actually surprised that it was not painful. That, of course, you feel the first prick, but it's nothing compared to having your bloods taken or getting an injection. It's nowhere near that. The needles are very, very tiny. They're like the thickness of your hair, so it's very thin, and the needles are flexible. So very often, this aspect of acupuncture with the needles is very, very small compared to the benefit of what you get from the actual treatment.
It's funny actually that you mentioned those needles, because I was always scared of it.
Me too. I was always thinking, do you feel like a hedgehog when you have all of them in your body?
Yeah.
But with pregnancy, but with pregnancy, we don't use a lot of needles. We don't need to. It's very, very few.
Yeah.
So it's nothing like using, 50 needles or something like that. No, it's just a few.
Brilliant. I love that we are able to talk to you about this, because I think there's so little knowledge about this out there in the normal, if you're just a normal mom being pregnant, then these are the questions you want to ask somebody, and usually there's nobody you can ask them to. So I really like that. At which stage of pregnancy can we actually start with acupuncture? Is there a stage when it is dangerous, or you say, well, don't do it? Or is it, can you use acupuncture and the benefits of it throughout the entire pregnancy? What is your advice?
You can use acupuncture at any stage of the pregnancy. The minute that you feel out of balance, you're experiencing some ailments, that's the time that you can start. So, like I said, like in the practice, I see women from first trimester, second trimester, third trimester. Sometimes when somebody contacts me for an appointment, on some occasion I might advise them to go and see their care provider, just to make sure that everything is okay from that side. But generally speaking, you can come for acupuncture at any stage, even after you've consulted with your care provider. Then you can start the acupuncture treatment. It's just on those occasions where I might feel that there's a need for more assessment.
And when you mention, like, for example, so if somebody is contacting you for an appointment, so how does the process look like actually? I know you've been talking to us before also about like consultation. What does happen during the consultation? To also start the treatments, to find out what's the right treatment.
Yes. At the first consultation, I always do like an intake. So the intake involves doing a tongue and pulse diagnosis, and also having some questions that I go through. So we go through a lot of questions, but all these questions may sound a little bit strange, but actually they are very important, because what I do is establish what is at the root cause of this issue that you're experiencing. Because in acupuncture, we treat the body as a whole. So it's not looking at the body as a fragmentation, like, in little pieces, but we look at the body as a whole. So if you're experiencing an imbalance in one area, we look at the other areas as well, because these the whole body needs to be in balance. And sometimes we just kind of balance things out, one here, one there, to get you to feel better. So a treatment, the first treatment is always a little bit longer, because I like to get to know you better, like your health, especially with regards to the pregnancy. How's this pregnancy going? But also looking at your health before the pregnancy as well. And then that gives me a really good picture. And also like with the support of the pulse and the tongue, that gives me like a whole picture. And then we can actually have a treatment plan. Some ailments, after you may only require just one or two treatment, but sometimes you may be that you need a more appointments, treatments to get to the problem, to get to the root of the problem, and also for you to feel a difference. I always say that Chinese medicine is slow medicine. So at some ailments we can get rid of after maybe one or a couple of sessions, but some ailments may take us that little bit longer.
Yeah, I can imagine that when you go into the root of the problem, depends what it is. Yeah.
Yeah, that's right, and how long you've been experiencing it as well, and if your pre-pregnancy health was not optimal, then it can be that we are then working a little bit longer to get some result.
So you already told us a little bit about what to expect when we do acupuncture in terms of discomfort or being scared of needles. One of the questions I always have with acupuncture, and I'm just gonna ask you because I didn't have the chance to ask anybody else yet. Is so you have these tiny needles that you insert into your clients or your patients' bodies, and the whole logic behind is that you clear out imbalances. But how exactly does that work? So if how does a needle somewhere clear out an imbalance eventually?
Yeah.
So what's the philosophy and the knowledge behind that?
Okay, so that's a very good question, right? But I try to explain it like in a very simple way. Is that you can look at your body as having like a highway system with little roads that goes to different parts of the country. So you have little villages, towns, and all these little highways and little roads. So what happens is when there's an imbalance, this usually means there's a blockage somewhere on the highway or on one of the little roads. So what we do then is the acupuncture needles just redirect the traffic. So that's a really basic way to explain it, very simple way to explain it. And we're just redirecting traffic. We might, direct traffic to a B road or an N road, whatever it's called here. And then you have it clears that traffic jam. So then it flows better. The traffic is flowing better. So this is what I do with the needles. It's just redirecting the energy, the blood flow, the energy flow, and that creates like a feeling of well-being, a feeling of like relief, especially when it comes to discomfort. If you have a little bit of discomfort, lower back pain, or headache, or anything that you may be experiencing, is just redirecting the flow of energy.
It's a really cool explanation. It makes things so easy and clear in my head now. Brilliant. Thank you.
Oh my God.
We should do a separate podcast, like long-standing questions answered with Kajanina and Corinne.
Yeah.
Exactly.
Yeah.
But so like thinking about like those treating the imbalances and like helping each other, like helping ourselves with acupuncture when we are pregnant, when we prepare for birth itself, because we've talked about different situations like insomnia, headaches, or back pain. But we also use a lot of acupuncture and acupressure when we prepare for birth, and not only when we are after our due date and we're like, I want this baby out, right? There's more that we can do, and I think what would be great if you can share with us a little bit what it is that we can actually help ourselves with, and when can we start the treatment?
Okay. I encourage women to start looking at preparing for birth around the
Mm,
36 weeks. Um, because we we work then on a schedule of like every time we do a little bit more and a little bit more, but it's also looking at if there's anything that needs to be corrected. So any imbalance that's there at towards the end of the pregnancy, getting the body back in balance, increasing your energy, um, making you feel more relaxed. Um, so these are all steps that we can take
mm,
earlier on, and that also then helps with when you get to 40 weeks or 41 weeks. Very often, women who have regular acupuncture during the pregnancy, the last trimester, we find that they don't go overdue.
mm,
So that's one thing that I always say to women: think about from the 36 weeks, starting to get some regular acupuncture treatment,
mm.
because it makes such a world of difference.
Yeah.
Um, yeah, but sometimes I know that women don't find out about acupuncture until they are overdue. So it's good that now we have the podcast so women can be more aware, become more aware of things that they can use to help. Huh?
Yeah.
So but women who come to see me at 41 weeks, for example, there are still things that we can do, because usually around that time there are some imbalance there which needs to be
Mm,
addressed, and then that helps them for their body to go into labor. So it's not that we are forcing the body. We are just working with the body, creating space, creating that flow of energy, a flow of blood and
mm.
energy, so that the body function better, and then the body can go into labor.
Yeah. Yeah. I mean, at the end of the
Yeah.
day, the baby has to go out, right?
Yeah, that's right.
Yeah,
Yes.
yeah, and I mean, I fully recognize also what you said. Like you, I also didn't, I knew about. So with my first baby, I only knew about acupuncture. That's something I should do in case I'm overdue. So that's indeed also what I did. I was like 5 days after my due date, and then I had the treatment for that. But it was only when I actually met you when I found out that you can do so much more also before. And especially now, if I have, for example, students who are being told that the babies are a little bit bigger, for example, so they are being told about 42 weeks would be too much. So for example, the care provider would be advising induction earlier, and that's also for me like the moment when I'm always sending them to for the acupuncture treatments, because it's of course a way to, like you said, that you don't go very often over your due date. Yeah.
Yeah. Yeah.
I think it's brilliant because in Germany, you know that most babies are born in hospitals, and once you go into the hospital, then oftentimes you're on a bit of a bit of a timeline to get your baby out, because there is they only have so many rooms, birthing rooms, or the doctors want to get,
Mm,
and the nurses and want to get the baby out in their shifts or whatever reasons, and they're all pretty good reasons when it comes to hospital. But it also means that you're being treated a lot of times with medication to get things started or to slow things down, and I think it's great to know that there are other ways to induce instead of going to a hospital and get a shitload of oxytocin or any other medication, and risk a very sort of unnatural, not very pleasant birth experience. And I
mm,
still think we know too little about what nature has in its reserve and has in pedo to help us get things going properly. So I love that topic. It's great to know that there's
yeah.
a
I
there's
think
a
we could
room.
spend a whole separate podcast on it. To be honest.
Yeah.
So we've been talking a lot about helping with acupuncture when it comes to natural induction. So very often we find an acupuncturist around us when we are overdue. But I think what a lot of women do not realize is that you can help yourself with those treatments also towards having a bit more smooth labor. Is that true, Corinne?
Yes, actually, there are some research that's been done about the use of acupuncture and helping women prepare for labor. And those studies have found that regular acupuncture in the third trimester has actually helped with shortening the length of the first stage of labor. So they find that that helps with that softening and opening and a thinning of the cervix. So that's a very encouraging study for mothers to know that that first stage, which is usually the most difficult and longer stage of labor, can actually be shortened. With acupuncture, you can prepare your body, yeah, to get into that, so increasing that that momentum. So it's not like starting the labor, because the acupuncture needles actually doesn't put anything new in the body, but what it does is using what your body has. So like I was explaining with the redirecting the traffic, this is what we do with the birth preparation as well. Is like we make sure that that traffic, if you like, or the flow of energy is going really well, that there's no obstructions. And with the women who are overdue, it's the same. It's really about redirecting the energy and making sure that everything flows very nicely. When you are overdue, the one of the aspects that I see very often is that there's a big a burden of this a date being given to you, if you like, and also that creates a lot of anxiety. So one of the things that I do is making sure that I reduce the anxiety, and that you're sleeping better, and looking at, okay, where is it in that energy flow that there's a blockage, and then we put some needles in, we, you know, and then we find that the energy is flowing better, and all of a sudden your body starts to do what it needs to do. And that's the beauty of acupuncture, if you like, is that we help the body to sort itself out.
I think it's important also for us to understand, because I had one student who was a bit like, no, I don't want to do a natural induction. My baby will come when it's ready. Like, well, yeah, but you know, everything that you do actually with that kind of work, it is working with your body, like what you said. Like you're not giving anything extra, no, nothing additional, and that's I think is also important to understand, that you really just work with what you have, but getting yourself more prepared.
It's not pushing the body in any way. It's using what the body already has, and just making that it's just creating that right environment, if you like. Once that right environment is achieved, then the body will itself go into labor, and everything, you know, will just work. It's just sometimes there are some imbalance there that we don't really see, but when we sit down and we ask the questions and we take the time, then you start saying, okay, there's that blockage. Because something like anxiety can create havoc. It's something that you don't have much control over. You can do some breathing exercises. You can do that as well, and then on top of that, you can do the acupuncture, and the two works really well. So it's just like a helping hand, really.
I'm also thinking probably there should be a lot of dads to be on your table as well, especially when it comes to reducing anxiety and insecurities.
Yes, of course, yes. Sometimes it creates a lot of stress and anxiety, and if you are both anxious, then you know that's double.
That doesn't help.
So
Yeah, cool. I wanted to quickly jump onto something you said, which I find is a brilliant bridge towards our next topic, which is obstructions. So we always in our courses and in our retreats, we also talk about possibilities to help turning a breech baby. So a baby that for some reason doesn't want to go into the right birthing position, and so creates a little obstruction on the way out. So when we have such a baby that's a bit stubborn and it needs some convincing to actually turn the right way and start moving out, we also heard that acupuncture can help with that. So can you tell us a little bit about that? Do you often help moms with the with turning a breech baby, and what kind of treatments are effective from your point of view? And also, when should we actually start thinking of those natural ways that acupuncture offers to turn a breech baby?
So again, a breech baby is just an imbalance again, because when you are pregnant, we say, like, if you look at yin and yang, we've all heard of yin and yang. So during the pregnancy, you are very much yin. But then towards the end of the pregnancy, we go to the yang phase. So that's what turns the baby. The yang force starts to turn the baby head down, ready for birth. So what happens then is when a baby is breech, is just a little bit of imbalance between the yin and the yang. And we can use then, I mean, what I do in the practice is I use a combination of acupuncture and moxa. So because I find that that's the best way to help mothers to get for their body to be more in balance. With the moxa treatment,
yeah,
we actually do. The moxa is, we use, like, it's mugwort, and it's made like in a kind of a cigar. It looks like a cigar, and we use it on an acupuncture point on the little toe. So this treatment is at the practices, I show the mom how to use it, how we do it, and then they continue the treatment at home. So this is really to get the baby to turn. So this treatment is, again, can be up to a 10-day treatment. So in that time, they are also taking into consideration what the plan is with the midwife or the gynecologist. But then we work with that as well. With this treatment, I would say for a first-time mom, if baby is not head down by 32 weeks, we can look at getting the baby to start the treatment, then to get the baby to turn head down. For second-time mom, it can be that the baby is not head down by 32 weeks. So we can also start a little bit later. But in that situation, I always say, even for first-time mom, we have to make sure that there's enough amniotic fluid, that it's not too much or too little, that there's still room for baby to turn. And also there are some precaution measures that we have to consider as well. So we have to make sure that everything is optimal for a moxa treatment and acupuncture treatment, because there are some occasions that I would say, well, no, I cannot. But usually, in most cases we can, but we have to make sure that we take notes of those times that in that is contraindicated, for example, that I would say, well, in that case, I cannot.
Mm-hmm. And it's the whole other topic out there. So we've spoke already about some of the treatments, like moxa, great example where you're actually instructing moms so that they can do that also at home. I can imagine that there are people who don't have acupuncturists in the area or close by or available at the time when needed. Is there anything that you can help also remotely when it comes to acupuncture, pregnancy, preparing for birth?
Absolutely. I mean, you can always book a session online, because there are some things that I can do remotely, such as the the diagnosis, for example, to find out what is causing the health issue. And also some instructions can be given online as well, with the support of written handouts or videos, or so that makes it a little bit more accessible for everybody. I had a client recently, for example, who I couldn't see, and we did acupressure for birth online. So then she was able to use some of the technique for her birth, in preparation for her birth, but also for during the birth as well. So that's just one of the example. The other one that I had was somebody with a breech baby, and also we did the consultation and the instruction online, and then I went and delivered the moxa stick. So then she could actually start the treatment. So there are possibilities.
Oh, brilliant, brilliant.
Cool. Yeah, that's really good. I think we all learned how valuable any tips and any help is that you can do remotely in these times or after these times. Wow, Corinne, I'm amazed. I mean, we've learned so much in just 30 minutes or so in this podcast, and there are still so many questions and so many topics we could talk about. So I do think that there will be other moments when we will invite you again, because yeah, there's so much we can deep dive into a little bit more. What we always do at the end of a Mamamoon podcast is like the golden tip. I should probably create some sort of banner in the video here. The golden tip. So if you could share just one thing with us, what would be the golden tip that you have for moms to be, or for also dads to be, whoever, for what is it that you would say, if you do just one thing, do this?
Okay, well, there's an old saying that I share with a lot of my pregnant clients, is that pregnant women should only look at pretty things. So that's I find it a really nice little sentence, because everybody smile when I say it, and they're like, oh, that's nice. But it's really about, when you are pregnant, is to not stress about things that you cannot fix now. So like, just kind of turn inwards, concentrate on yourself and your baby, and the rest can wait. So anything that's causing stress, anything that's causing anxiety and cannot be fixed, it can wait. So I love that saying, because it's really about, just look at the pretty things, like stay positive, and look at the positive side of life, because this time of pregnancy is so precious, and it's a time for women to really take that time to nourish their body and connect with their baby.
It's actually also life wisdom that is especially true for when you're pregnant. But I think if everybody of us could follow that tip for just a little bit in their normal lives, it would help us all tremendously. Yeah.
Love it. Super, thank you so much, Corinne. It's amazing. Thank you for your time, for sharing the knowledge. Like Nina said, we'll invite you probably again when we want to talk a little bit more postpartum and more other topics. So if let's say our listeners would like to find you, how can they find you? What's the best way to contact you, to reach out in case of questions or?
You can contact me via my website, which is www.amsterdamacupuncture.com. Very easy. You can find the contact form there, and you can send me an email, and there's also my telephone number where you can also send me a message. That's the best way to contact me. And I would like to say thank you so much for having me on your podcast, and it was a pleasure to be there, and I look forward to be on it again.
Yes, same here. Yeah, absolutely cool. We'll make sure to drop your contact details also in the show notes of this podcast. And people can also reach out to us, of course, if they have any questions for you, and we'll redirect them to you for sure. Thanks a lot for being with us today and explaining so many things. I really think it's so much needed to get a little bit more of knowledge out into this world when it comes to sort of natural ways to support us during pregnancy and labor and birth and also after.
Absolutely.
Thank you.
Yeah. Thank you so much.
Brilliant. Thanks, Corinne, and hopefully we'll speak soon to you again.
Thanks so much for listening to our Mamamoon podcast. We would love to see you again, so make sure to subscribe so you don't miss any new episodes.
Also, for more information and to stay up to date, check our website mamamoon.me and our Instagram and Facebook.